Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Wynn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. All right, welcome to another episode of the Healthcare Connections podcast. I'm really excited to have this guest on today. So we've got one of our own from Healthcare Compliance Pros. We've got Jodi Faustlin with us today. And Jodi, I don't know your exact title. I just know you're like our compliance guru. You help us with, lots of things around compliance. But I thought it'd be good to let you introduce yourself to our audience. Some of our clients certainly have worked with you and know you, but probably many of our listeners haven't. So I want to give you a minute to introduce yourself.
Sure. I am the Chief Compliance Officer here at Healthcare Compliance Pros. So I do some of our internal compliance work, and I do a lot of work with our clients on whether it's being a fractional compliance officer for them or general questions that come in about compliance, how we can help all of our clients improve their own compliance programs. I actually was in practice management for several years and then transitioned over full time to compliance in the last year because I'm one of those crazy people that thinks compliance is fun. I have a professional law degree and have been in healthcare for over 25 years. So this feels like a good landing spot right now. I really enjoy it.
You're one of those people we all worry about. You kind of nerd out on compliance, but everybody needs somebody like that. And so we're grateful at Healthcare Compliance Pros to have you on the team. So thank you, Jodi. Today, our topic, we get asked about artificial intelligence all the time. We get asked to speak on it as we go to different national trade organization shows all around the country. And so I thought it'd be good to do an episode on that. And what we want to focus today on is some things to consider when you implement AI into your practice. And so, first question I have for you, Jodi, right out of the gate is what are some of the biggest concerns you see with AI from a compliance perspective?
The number one thing that I always think about is protecting your patient's data. So HIPAA is top of mind for me because there are so many free resources out there that anybody could use. And you want to take it and say, how can I make this letter to my patient better? So you put some information in Chat GPT and ask it a question. And suddenly Chat GPT has all of this information about your patient, but you got maybe a great letter. We forget that we don't have business associate agreements with those entities. They're not obligated to protect our patients' data. That's our responsibility. So I really worry about if we don't talk about it, if we're not acknowledging the risks within our own organizations, our workforce members in a practice are going to go out there and try to use these free resources to improve their work product. It's a great reason, but the risks to the organization are so great. So I always want to make sure all of our clients, everybody understands if you're going to use a model, if you're going to use something to improve your documentation, you've got to have a business associate agreement in place. They need to understand how to protect the data. It's electronic, so it's absolutely covered by HIPAA. And what are we going to do to train our staff on what to look for? I know we have a draft policy that we're using with our clients that talks about how to implement AI. What kind of verification do you need to do of the AI vendor before you sign that BAA with them? The other side that I have concerns about is the clinical stuff. And we can get into that if you want to talk about some of that.
Yeah, and I was going to just suggest you mentioned policies, that we've started to build for our clients. And I would just offer that to the audience, if you want a sample or an idea on what does an AI policy even look like, feel free to reach out to me or Jodi. We'll share our contact information at the end of the podcast. But again, our goal is to be really helpful to our clients and to the industry. And that's a big one I've been asked as I've talked about this at conferences is where do I start? And I say, well, do you have a policy? And so far, nobody has told me yes at this point at the conferences. And so I want to offer that up is, reach out to us. We can get you maybe a sample of that. So yeah, thank you for that initial thought on the PHI. It's vital. Beyond PHI, I guess, what are some of the, and you mentioned clinical stuff, what are some of the other risks that you see that healthcare practices need to consider with artificial intelligence?
The first thing that comes to my mind is we all want to make our practices more efficient for our providers. We hear
Mhm.
about provider burnout, and we want to make the processes as effective for them to document and get through their patient visits and not have all the pajama time at the end of the day
Right.
documenting in the medical record. So it seems like a great idea to use artificial intelligence to help, whether that's with the documentation of simply recording your voice and creating the note for you, or using it to assist in medical decision making because there's a whole lot of data out there. One of the biggest things that we see as a problem with using a dictation type of AI is providers are forgetting, or clinicians are forgetting to edit the data
Yeah.
and make sure that it heard you correctly, that it didn't make any assumptions about what you said, and that the note actually reflects what you did in the visit. Because ultimately, when you bill a claim, it can only be representative of what you did in the visit. So
Hmm.
you've got to verify, trust it, but always verify that what it puts in the record is what you actually did. The other side that I have a lot of concerns with, and I think there are big concerns in the industry, are we know that when it's used as an assistance for clinical decision making, I'll tell you, the American Medical Association calls it AI augmented intelligence, not artificial. They want to take the perspective that this mechanism can help a clinician make a decision, but there's so much data out there that has bias behind it.
Yeah.
We know that a lot of the cardiac studies, for example, only included a subset of our population up until about the last 30 years. So when you look at your patient, you have to take into account that the data is still reflective to this day of biases in our system, limited data sets, and things like that. So it's an aid for
Yeah.
clinicians, but they can't 100% rely on it. I mean, there's a University of Virginia study, even from 2016, of their own student and resident body. And what they found was that of their white students, about half of them had the understanding that darker skin color represented thicker skin, less pain feeling, or more tolerance for pain, and things like that. So those
Interesting.
biases can impact their medical decision making, which then impacts the data.
Yeah.
So we have to understand that there is bias if you're going to use it for clinical decision assistance to augment as a tool, as the AMA likes to emphasize. What's the data behind it? And I think a lot of clinicians absolutely understand that. It's maybe some of the lay folks that are trying to provide these tools that clinicians that to clinicians that they don't really understand what the problems are that it could create. So the biggest risk opportunity that we would want to focus on is making sure that the data is vetted, that a clinician notes that if something was used, that that they understand it, they vetted it. You want your documentation to reflect if there's any assistance, but you also want it to reflect that you vetted the data.
Absolutely. No, I love that term augmented intelligence. I,
Hmm.
I think that's a smart approach to that and to think of it through that lens. Um, and certainly there's some exciting tools out there. I mean, I've seen people as we've gone around talk about how they're using AI. You mentioned kind of documentation, scribe,
Hmm.
scribe tools, even diagnostic tools are popping up out there and being tested. Um, One of the concerns and I don't know if you have any experience or talking maybe about this, but from a liability perspective on the diagnostic side, if you relying wholly on on AI, right, for your diagnosis, what's the liability there? That I think there's maybe some unknown there. I'm curious if you could speak to that for just a brief moment as well.
Sure. I think that the two biggest things that pop to my mind are symptom checkers or virtual triage that a
Yeah.
lot of health systems are starting to use. And it's just like anytime somebody calls the office to leave a message for the nurse that will handle triaging. There's always the disclaimer of, if you're in a medical emergency, call 911.
Yeah. Yeah.
And you need to have that same kind of disclaimer with a symptom checker or a virtual triage, that if you're experiencing chest pain or things like that, the same type of stuff you do on your voicemails or within your patient portal. If it's emergency, if you feel like it's an emergency, call 911. Beyond that, you want to make sure that the vendor that you're using to provide that service for you is really vetted. You want to understand where they're getting their data. Is it comprehensive enough to address your population? The more diverse your patient population is, the more diverse the data set needs to be from the vendor that you're choosing to use, so it can help reflect. But you always want to make sure that the patient has an alternative if those virtual assistants confuse them, if they're not quite getting what they want, they need to have another avenue to reach the practice as well, so that you're not isolating them to this chatbot type of response. They can get to a human if they need it. Because the last thing we want to do is create more confusion.
Yeah.
You don't ever want to give them the answer of, okay, you got chest pain, take some aspirin, because the chatbot might have misunderstood it. You always want to make sure it's clear, it's simple. If anything sounds complicated in what the patient is saying, get them to the practice. Emergency, get them to 911. Those kinds of things. You want those disclaimers out there for sure.
That's great advice. I love that. Okay, I got one more question for you because we are coming up on our time.
Yeah.
This isn't something I know much about, but if anybody that's listening has heard of this, and maybe you can explain, what is an AI hallucination?
This is fascinating. And this is when it comes back to that trust but verify, because AI is so smart, but it can also give you the completely wrong answer.
Yeah.
If you input enough data into something like one of the free pieces out there, and I don't want to name any particular stuff, but it will give you this wonderful sounding answer that seems like it's got references and data to back it up, but it is totally wrong. It hallucinated the answer. And I actually attended a conference where there was an attorney that was speaking, and he went through the process of giving uh, an artificial intelligence engine enough data to convince it that a well-known athlete gave a speech at another person's retirement event, but it never happened. But it gave it enough data to convince the AI, oh yeah, here's what they said when they were there.
Yeah.
Totally false. So it can absolutely hallucinate an answer for you, which always takes you back to that trust but verify. It's created by humans, so it's going to have errors just like humans.
That's amazing. Yeah, I had never heard that term, so thank you for explaining that.
Sure.
Well, Jodi, we are at time. I'd love though, for with your knowledge and expertise, it's so valuable having on here for our listeners. One piece of compliance advice. It doesn't have to do with AI. What's one of the biggest things you're seeing right now that people are having issues with when it comes from a compliance perspective?
I will actually still tie it to AI,
Okay.
because my biggest concern is how a breach happens, how people get to your data, how those bad actors get in. And AI is being used to generate really good looking fake emails to get to people to click on a link that lets the malware in or gives access to a cyber attacker. And they've got not only your patient's data, but your business data. So I'm concerned with people thinking we're small, it's not going to happen to us.
Yeah.
And or we're big and we've got enough stuff in place, we're going to be okay. Because the majority of these cyber attacks are happening through emails
Yeah.
and a link, and they look so good. And when you use AI, it looks even better than something I could generate. So I want to encourage everybody, always make sure you're encouraging your employees, your workforce, not to use your work email for personal stuff, because that just creates more questions of
Yeah.
those emails that come in. Because it's Amazon, I'm expecting a package. Is this a legit email? The more stuff that comes in, the more opportunities you've got for a bad actor to follow right in and get your data.
And who doesn't love a good Amazon email telling you your shipment is about to get there that you're waiting on, right?
I
So
know.
it's at your doorstep and you get so excited, and there you go. Now you've just opened yourself up. So thank you, Jodi. So valuable. Thank you for being on. And to our listeners, we hope you enjoyed this episode, and we'll see you next time.
Thanks.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.